If you are a gentleman over the age of 30 considering going the testosterone replacement route, today's video we're going to dig into the good, the bad, and the ugly of TRT. There are critical things that you need to know and that you need to consider, as well as lab values that you need to have run before you enter this point of no return therapy. If you're interested and curious, gentlemen, let's dig into today's video. Welcome back, gentlemen. It's Dr. Melissa Gallagher here. If you're new, welcome. I'm a naturopathic physician who has been working with gentlemen for over 15 years now, helping them regulate, manage, and balance their hormones. And in the last 5 to 7 years, I have seen an exorbitant amount of increases in inquiries about testosterone replacement therapy, as well as gentlemen who have done TRT but have stopped, and that has caused a whole assortment of imbalance in their body. Today, I want to share with you the good, the bad, and the ugly, and points to consider if you're on the doorstep of entering this long-term therapeutic resource. First, it's important to know this is a highly unregulated Wild West of therapies that we're seeing entering fields like fitness and urology. It's kind of crazy, but there are a lot of individuals or specialists who really do not know anything about hormone regulation and balancing and managing hormonal imbalance. Now, on one side, as a gentleman, increasing your testosterone levels is wonderful. It'll give you energy, it gives you vitality, it helps support a healthy sex life. It can also benefit your metabolism, it lifts your mood, and you can boost your muscle tone, enhancing weight loss. And a lot of my gentlemen who are on this long term experience feeling like they're 20 to 30 years younger, which is awesome. But there's a dark side to this therapy, and that's also some of the things we're going to dig into today. I will see male patients who are in their 50s and 60s who have considered TRT. Maybe they've completed a few rounds of TRT, pellet injections or creams, who have had intense spikes in their testosterone that has yielded elevations in PSA levels and inflamed prostate glands. It's also caused a whole assortment of estrogen dominant symptoms that make them feel like more their wives and less like their male counterparts. These health challenges that my gentlemen come to my practice with are a direct result of a quick abundance of this synthetic controlled substance. That is what TRT replacement therapy is. It is a controlled substance that is synthetically manufactured to mimic and mirror what your body would naturally produce. And gentlemen, even gentlemen in their 90s and 100s, are still producing testosterone. So despite what you get told that you're no longer manufacturing it, unless we have a full scope of your hormone levels, that often is not truly the case. My goal in today's video is to help you avoid some of these nasty side effects if you're on the fence or considering TRT. So the good of testosterone replacement therapy is it can help so many men who are dealing with hormonal imbalances. One of the core hormonal imbalances that leads men to replacement therapy is something called hypogonadism. And this is where the brain to testes connection is misfiring or completely not communicating, meaning there's some sort of disconnect. Sometimes it's in the brain, sometimes it's in the testicles. Maybe you've had surgery or chemotherapy or a removal of a testicle, and that's the core reason for low T. If that's the case, this is where this therapy is so beneficial. I'm going to be completely frank with you, gentlemen. Hypogonadism is the only reason why you would consider going the route of testosterone replacement therapy. These gentlemen are also closely monitored by experts who are running an assortment of critical hormone tests as they are on testosterone replacement therapy. I'm going to share with you here on the screen the assortment of tests that are being run that gives the whole scope of hormone balancing necessary for men undergoing testosterone replacement therapy. They are free T, total testosterone, SHBG, which is the sex hormone binding globulin, DHT, cortisol, as well as insulin. Now, I know many of you who might be watching today's video have been tested and have been labeled as having low T, but not all T is the same. You might have seen on the screen, there's a free T, free testosterone, and total testosterone. Those two values are often not the same, and it's very common for gentlemen to get labeled as low T when one of those values is lower than normal. But that doesn't give us the whole picture and will not provide a hypogonadism diagnosis, which is really critical because I know a lot of you are considering this therapy, but you might not really fall into that category of needing hormone replacement therapy. Now, the benefits of testosterone therapy for these gentlemen, it's amazing. It increases their energy, it lifts their mood, it gives them better muscle tone, it enhances their metabolic process, supports the slowed aging process, and overall makes them feel great. Considering that an assortment of the hormones that are being tested and monitored are often skewed, it makes sense that this is a valid and highly beneficial therapy that can benefit men that fall into a specific category of testosterone dysregulation and hormonal imbalances. All right, gentlemen, I'm going to share with you the bad aspects of TRT. Number one, it's highly unregulated. There are a lot of individuals who don't qualify with extensive hormone balancing and hormone expertise that can administer TRT, which leads to number two, unqualified providers. And unfortunately, a lot of these unregulated, inexperienced, unqualified providers do zero hormone testing. So they're administering testosterone, a synthetic controlled substance, to individuals without even testing where their levels are before they give them a shot, a cream, or a pill. The unfortunate part about TRT is that you are replacing your body's natural function and production of testosterone. When you're using a synthetic controlled substance, you actually shut off your body's natural ability to produce testosterone in the future. We find that both doses and the time frame between doses varies based on these inexperienced, unregulated professionals. So there's no real treatment protocol or rhyme or reason of when you're getting a dose and when you're not. TRT can mask underlying imbalances like cortisol imbalances, insulin dysregulation, and insulin resistance, as well as nutrient deficiencies, as well as a poor lifestyle and a poor diet. There's limited research about the long-term effects of TRT. Something for sure that a lot of men are not aware of is that when they replace their natural testosterone with TRT, there are contraindicators or interactions with the elevation of testosterone through this synthetic controlled substance and the medication they might be taking to lower their blood pressure or to balance their blood sugar or to lower their cholesterol levels. It's really critical that you're aware of that potential interaction where if you are trying to lower the enzymatic reaction that takes testosterone and converts it into estrogen, if you front load your body with more testosterone, you're going to also front load the need for those enzymes, making a lot of the medication ill effective and requiring higher doses of some of those additional medications. Now here's the ugly part of TRT. Number one, the ugliest part of it is that once you're on it, you cannot stop it. Meaning it is a lifelong commitment once you begin testosterone replacement therapy, because by either taking the pill or the shot or the pellets, you are turning off any remaining communication between the brain and your testes. And that is one of the reasons why this is so ugly when gentlemen go on it for a short period of time or aren't ready or aware that it's a long-term, lifelong commitment from the beginning of their TRT. Now, another ugly aspect of TRT is it can jeopardize your health. It's not uncommon for us to see gentlemen have positive short-term effect, but the long-term effect is still in question. We don't have enough clinical data. We've only been really seeing this type of category of hormone replacement therapy for men in the past 10 to 15 years, which means we don't have a lot of long-term assessment and analysis of the long-term benefits as well as the long-term side effects. But I will tell you, I see this a lot in my practice. Gentlemen who have had a short time frame of TRT, they go off it and guess what happens? They have a total flat line of their testosterone levels. Their levels end up being lower after TRT than they were before they started TRT. On TRT, I will see them have elevated BPH. I'll also see them have elevations in PSA levels, and it can kick off prostatitis and inflammation of the prostate gland. I've also seen gentlemen who don't resolve some of the underlying hormonal imbalances. I've also seen them create a situation where they have more testosterone that ends up being converted by their body via stress and imbalance. That conversion from testosterone into estrogen is greater. And that is really, really critical. If you don't clean up some of those precursory hormonal imbalances that might be driving some of your testosterone levels subclinically low, when you add in TRT, that ends up not resolving the imbalance. It sometimes creates even more imbalance. For gentlemen who prematurely stop TRT, it can trigger and cause andropause. That's like a male menopause. Another ugly aspect is that it is expensive. Two other ugly side effects of TRT can be hair loss and changes in your heart health. And I think one of the ugliest aspects of TRT and the world of TRT is we have a lot of individuals who are not experts in hormone management. We have a lot of individuals who are trying to make a buck and push TRT on individuals who don't necessarily need it or who do not qualify, or gentlemen who would not be diagnosed with hypogonadism. And this is one of the reasons why this is the ugliest part of TRT. I end up working with a lot of gentlemen on the post-TRT effect, where they have an assortment of additional hormonal imbalances or have the prostate-related challenges and imbalances that were kicked off by TRT and the sudden shut off of that therapy. It is a wild, wild west in terms of the clinicians that are in this field. It's not uncommon for you to have a fitness center, a urologist, and a nutritionist get into hormone replacement therapy. And unfortunately, gentlemen, I'm going to level with you, they are not qualified and they are not experts in the world of hormone balancing and hormone dysregulation that ends up getting kicked off. So here are a few questions to consider in terms of the good versus the harm of TRT. Do you need it? Is this optional? Are you ready for a lifetime commitment? Are your symptoms tolerable? Have you tried to manage your symptoms naturally? Are your symptoms treatable? And do you have the money, i.e. budget, to commit to this long-term therapy? At the end of the day, this is an individual decision, and I wanted to give you an assortment of points and things to consider. I hope you'll consider having some of those base level labs run, and for sure, make sure you take some time to evaluate if this is something you're ready to step up to the plate to. Now, choosing TRT is an individual decision, and it does require you being educated, being cautious, and aware of this whole entire environment, both inside your body as well as within the TRT community. If there's one important takeaway I can give to you with today's video, is that TRT is not a short-term fix. It is a long-term, lifelong commitment, and you have to be ready for that if you want the max benefits of TRT and you want to make sure that you qualify for this treatment. Otherwise, there are a ton of other options to improve your hormone balance and increase your testosterone naturally. So my question of the day for you gentlemen is, have you considered TRT, and are you currently undergoing TRT? Or maybe you have in the past, but you've stopped and you've had some imbalances because of it. Comment down below. I'd love to hear from you. I also want to encourage you to subscribe and make sure you hit the bell. Next Friday's video will cover the top 7 supplements gentlemen over the age of 40 should add to their diet. So if you enjoyed this video, please give me a thumbs up. Make sure you comment with any questions that you might have about your own health situation. And be on the lookout. I will be posting information about my March Men's Hormone Health Workshop. So you'll want to make sure you get registered for that. I'll include some information in the description box below, and I will see you on our next video.